Welcome to Conversations from Stritch. Today is Thursday, April 10th. I'm Dr. David Livingston, president of Lewis University, and I'm joined by Dr. Christopher Sant, our provost. It's been a busy week at Lewis, but before I go there, let me just say that April 10th is now my granddaughter's birthday because she was born this morning, about 8:50. So we're really excited to have her in the world, and I just wanted to say a shout out. Maybe she'll be watching this 20 years from now on YouTube. Happy birthday to my granddaughter. So we're excited about that. This week's community hour featured help from librarians that were conducting an effective research. So how to do research well. It involved a spin class, some short films in our new theater tuition exchange overview, as well as many club meetings. So Wednesdays are always exciting days here on campus because there's so much going on. And Wednesday night this week, we had last night, we had the Windows reception, which celebrates the annual publication of the Windows magazine, which featured award-winning selections of art, poetry, fiction, creative nonfiction, research essays by students and staff. And just a couple things on this before I move on. We both went last night. I was saying in talking about it that it's such an inspiration. We had all the artists, and these are both alumni, staff, and current students. And I was just taken, we had a few students of ours from our prison education program who were awarded for their writing or their poetry. And they weren't able to be with us last night, but it was just really great to be able to honor them and for them to kind of contribute to a magazine that now they can see themselves published in. Tuesday night, we had the speech language pathology white coat ceremony. It's a recognition ceremony for those that will be graduating in May, I think, and potentially August for their speech language pathology. And they're gonna go out into the world and do some great work helping people to communicate. Tonight is the 17th annual President's Art Show. That's at the Brent and Jean Wadsworth Family Gallery. I'm really looking forward to it tonight. We have about 100 pieces up on the wall and on pieces that are in the middle of the room. And it's free and open to the public. It starts tonight at 7. We're looking forward to giving out some awards. Dean Swain will be there. We appreciate Natalie and all of her work. Natalie Swain works in the gallery and makes sure that all of these shows happen, so we're really grateful to her, but especially grateful to all the artists who submitted to the President's Art Show. And again, that's current students as well as alumni, and so it's a really, really great show. If you can't get there tonight, which I recommend, we'll have a little social time and honor some of the people who submitted their work. But you can swing into the gallery anytime during the week if you're just between classes and you're walking by. So a really great thing. And then Saturday, we're really excited to have Campus Visit Day for prospective families and newly admitted students and newly committed students. We expect a really large group. I think over 300 families are registered. Good weather. We'll have a lot of great information and, of course, talk about all sorts of academic programs and co-curriculars and all of those kinds of things. So it should be a really great day on Saturday. So, Chris.
Yeah, it's been fun. Hi, everyone. It's been a fun week. That celebration last night was really, really inspiring. Seeing the great work by our students and staff and alumni. I think some of the work in the President's Art Show was actually selected as winners in the Windows magazine. So we'll see some of that in real life tonight at the show. So here's some news. Lewis University has made the U.S. News and World Report's Best Graduate Schools ranking list. 3 programs and 2 specialties made the 2025 ranking. These included the ranking for Best Education Schools, Best Nursing Schools in both the master's and the doctorate categories, Best Occupational Therapy, and Best Social Work. So congratulations to all of those programs for that great honor. Almost 50 Chicago Area Business Aviation Association mentors shared insightful information with more than 100 Lewis University students on March 26th during the 2025 CABAA and Lewis University mentoring roundtable event in Romeoville. During the networking event, the business aviation professionals shared their experiences and provided aviation students with connections and resources to support their future professional success. CABAA supports the future of business aviation through their dedication to education support by offering relevant information, training, and networking experiences. Our students from Lewis are eligible for scholarships funded by CABAA to further promote their education and success. So this relationship has flourished over recent years, and CABAA has sponsored especially female aviators competing in the annual Air Race Classic, which we all love to track. So thank you for that great event, and it's a great relationship. I'd like to express congratulations to Dr. Claire Rothschild, professor of theology at Lewis, who attended the 2025 Midwest Meeting for Biblical Studies held on March 14th through 16th at St. Mary's College in Notre Dame, Indiana. Aside from acting as a chair for 2 of the sessions of the Early Christian Gospels seminar, she presented a paper entitled "The Cheese Stands Alone," an overlooked reading of 1 Corinthians chapter 3, verses 1 through 3. I don't know that verse, maybe you do, but I want to know what it has to do with cheese now with that title. Aiming to promote the scholarly study and investigation of the Bible and related fields, the Chicago Society of Biblical Research and the Catholic Biblical Association of America sponsored that event, which provides a platform supporting those engaged in such studies. So congratulations to Professor Rothschild, who has many accomplishments in this field. And then looking out a little bit into some events, one event that's happening on Saturday, I know we can't go to, either one of us can't go to because of so much going on in Romeoville on Saturday. The St. Augustine College at Lewis University's Student Council and Student Success Center hosts its 3rd annual Family Day event for students and families. Friends and families are invited to join the fun from 10 to 1 on Saturday at St. Augustine Hall on the Argyle Street campus. Children's activities, giveaways, and raffle prizes are among the fun activities. Educational resources will also be available focused on time management, financial planning, parenting as a student, and employee benefits, among others. So please try to join that if you're a St. Augustine student, and thank you to everyone in the St. Augustine community who makes that a really special day. Our annual celebration of service will be on April 16th at 3 p.m. here on the Romeoville campus. Here we will honor faculty and staff who've served from a wide range of 10 to 40 years at Lewis, as well as recent retirees. We're excited to announce that the 13th annual celebration of scholarship will take place on April 23rd and April 24th here on the Romeoville campus. On April 23rd, during the community hour, we'll have an extended community hour for some large public events during that time. And then on Thursday, April 24th, we'll have the usual long 10 to 6 p.m. Celebration that is a campus-wide student symposium open to all undergraduate and graduate Lewis students. Celebration of Scholarship provides a platform for showcasing research projects, artistic creations, and innovative ideas, allowing students to share their achievements with faculty, peers, and the broader Lewis community. It highlights the diverse talents and intellectual contributions of the students from various disciplines, and students are encouraged to present their work in various formats: oral presentations, posters, business plans, creative performances, exhibits, reflecting the richness of scholarly and creative endeavors across the university, and really at all universities. It's really a celebration of scholarship that really puts on display all the great things that happen at universities, especially by our wonderful students. It's favorite day of the year. It's so fun. I learn so much stuff, and I get inspired by all the great work that our students are doing. The Philip Lynch Theater presents Ride the Cyclone by Jacob Richmond and Brooke Maxwell, coming up soon now. Musical follows the lives of 6 teenagers from a Canadian chamber choir whose lives are cut short in an accident aboard a roller coaster. When they awake, a mechanical fortune teller invites each to tell their story of a life interrupted, offering a prize like no other, the chance to come to terms with their fates and possibly a chance to return to life. Very exciting. The first weekend is April 25th through the 22nd, and the second and closing weekend is May 1st through 4th. So contact the box office of the theater to purchase tickets for that. So that's looking into the future, and now now we're going to turn to what's happening
what's
today.
going on now. Just a couple quick comments on a couple things you said. So, celebration of service and Dr. Rothschild. So I was signing the kind of certificates for the 20-year, 25-year, 30-year, 40-year. And I don't remember whether Claire is 20 or 25, but she's either 20 or 25.
Oh, great.
So not only is she an amazing scholar, an amazing teacher, she's devoted most of her career to Lewis University and really made a big difference. And of course, we have lots of people in that category, so we're really looking forward to celebrating with that group of people. And I agree with you, the celebration of scholarship, well, really this time of year, I think we always say this, such a busy week, it's so amazing, there's so much going on, but this time of year is totally true. Like every night there's something going on, and we're just celebrating one group after another. Celebration of scholarship is just one of those. So a few things going on this week. The Weisenthal Colloquium, Mathematics for Human Flourishing, is happening Thursday night tonight, as well as the President's Art Show, as you see on there. Men's volleyball hosts Loyola. I know what I'm going to be trying to do tonight is I'm going to go to the President's Art Show. I have to say a few words and congratulate the winners. And then I'm going to go over, if it's still going on, to the Loyola Lewis match. We beat them at Loyola, so hopefully we can sweep them this year. They're at number 1 in the rankings right now in the MIVA. So big match tonight, so we'd love to fill the place. So come on over. It's Ray Strong night, which is exciting. And then also at 7:30 tonight, which I won't be able to go to because I'm going to be involved in both these other things, is the Raven Sextet that is going on. It's a super group that will be doing a concert over in Convocation Hall. Tomorrow we have Miss Cultura, the informational night about that in the Student Center. We have the Project Singery, which is a bags tournament, and I don't actually know what the Project Singery is, but we're raising money for that with the bags tournament. And then baseball hosts Quincy, which will be a great event. We're also having women's lacrosse versus Maryville, which will be on campus this weekend on Friday night. And there's a bonfire over between the Residence Hall, JP2, Dorothy Day, that whole area. There's going to be a bonfire night sponsored by Sigma Lambda Gamma. So go out and, I don't know what they're doing. Maybe they're doing s'mores or something, but come on out at 7 o'clock. Unity Ball is tomorrow night. That's a huge fun event. It's off campus. I think it's over in Oak Brook, and they do a dance. So if you want to, I don't know if there's still tickets available. I assume there are, but Friday night, get all dressed up and go out and have fun. Saturday, we have the Campus Visit Day, which we mentioned. We have the baseball 50th anniversary. That'll be great. An event to celebrate 50 years of baseball at Lewis. We also have some other events that are coming up. Baseball will be paying Quincy after we celebrate the 50th anniversary, and men's lacrosse is playing UIndy. A lot of the spring sports teams are wrapping up their season, so get out, and if you haven't gotten out to see them. Sunday, of course, we have Mass, and then you see that the Muslim Student Association is having a henna fundraiser. So if you've never had henna, it's really worth doing. My daughter-in-law is from India, and so at the wedding, lots of henna. I didn't get any myself, but lots of people in my family did.
There's an opportunity for you.
Here's an opportunity. I can go get it on Monday. So we also have the Impact of Microaggression that will be happening as a virtual event. There are some travel events. We have the speed puzzling also, I should say, on Tuesday night. And then, as we said, Wednesday, celebration of service. We got our normal stuff, Student Senate, that happens because of Community Hour. So there's a virtual reality club open house. There's a book club for Lewis. So lots of things going on next Wednesday. And then we have some traveling for our athletic teams that we'll be doing. Tomorrow and Saturday, track and field will be at Olivet Nazarene for the Tiger Open. Tennis will be at Maryville. Softball will be at McKendree. And then on Sunday, men's golf will travel to Indy for the Ken Partridge Invitational. So lots going on. But we are excited to have our guests joining us. So Chris, I know you're going to invite our guests, welcome them onto the show and start the conversation with them. But just exciting time of year. 5 weeks left in the semester, just as a reminder to everybody. We got a little Easter break in there, but 5 weeks of classes, which is incredible to me. That means we've done 25 out of 30 weeks, or I guess 32. It's like kind of 15 and a half, 16 weeks. But we're almost there.
Yeah, it definitely feels like we're rounding that final corner, and it is a really exciting time of year, and I wish I could be at 3 places at once.
Me too.
Tonight, especially. But I'll try to go back and forth to all of them. Before I introduce our guests, let me remind you to email questions in, and we'll get them into the conversation. You can do that by sending an email to the email address at the bottom of the screen there, askus@lewisu.edu. So you just mentioned that there are 5 weeks left. I think we have maybe 3 shows left, maybe 4, and they get really busy at the end of the year because we celebrate commencement. We do some other thing. We have a celebration of scholarship show coming up. So we really wanted to get this. Every year this happens, and we can't find a perfect spot during National Nurses Week to celebrate nurses, and we always really want to celebrate nurses. So we are getting it in this year before that final run of shows happens. So May 6th through 12th is National Nurses Week, and the whole month of May is a time of recognition for nurses, and we really wanted to, as I said, get the show in and celebrate the wonderful nursing programs we have here at Lewis and really celebrate the profession in general. So to help us with that, I would like to introduce our 2 guests. I'll introduce them both at the same time. Dr. Tina Bobo joined Lewis in 2021 and is the program director of the undergraduate traditional nursing program. In addition, she coordinates the HRSA Nursing Workforce Diversity Grant and worked at Edward Hospital for 22 years before going into academia. She also has the honor, I noticed as we were beginning the show, of being featured on our video that we show at the beginning of every episode.
Hundreds of shows.
Yeah,
you have been.
And there she is. The last time she was on the show. Natalie Zuby is a senior nursing student graduating this December. She is a HRSA NWD grant scholarship recipient, and she will be the president of SNA in the fall. So welcome to you both.
Welcome,
thank you so much.
Thank you.
Thanks so
for
much.
having us.
Thank you so much for being here. It's awesome.
It's an honor. Thank you.
Yeah, and Tina, thanks for joining us again. So I think we want to begin maybe where I began, which is what is National Nursing Week and how is it typically celebrated?
Excellent. Thank you. Thanks for having us to celebrate this special week. I think sometimes we kind of forget about that it's here. So National Nurses Week is May 6th through 12th. And it was initially signed as a proclamation by President Ronald Reagan in 1982. Natalie, of course, wasn't born then. I was actually graduating high school at that time, believe it or not. So it's celebrated every year that same time, that first week of May, and it's actually celebrated at the same time as National Teachers Week. So certainly our nursing faculty, we want to recognize a dual duty for celebrating them. And just in being in healthcare, in an acute care setting, hospitals definitely recognize Nurses Week. Across the country, there's lots of always funny memes about what nurses get in hospitals to celebrate Nurses Week. One of the funny ones I remember seeing is nurses each got like a rock. And it said, "You're a rock star." But of course, they got other gifts too to go along with that. We usually get like a nice.
Not like coal, is it?
No, not like coal. But we usually get like nice water bottles or something to make us happy. Carts that come around with healthy snacks on every shift. And usually the chief nursing officers come around, even on the night shift, to recognize nurses. They give out awards and things like that. But I love that it's celebrated in the same week as National Teachers Week also. So we get dual recognition.
So I was just looking up because I was wondering. So there are, according to Google, 4.7 million nurses in the United States. That's incredible to me. It's like, you know, like somewhere around, like we have 330 million people, so it's like 7% of the whole entire population in this country is a nurse, which is incredible. And we're so grateful to both of you because all of us, certainly I can speak for myself, you know, sometimes when you're dealing with nurses, not always, if I just go for a regular, you know, yearly checkup, you know, they're doing their normal thing. But when I'm in the emergency room, which I have been in before in my life multiple times, the nurses are like, you're in crisis and you are the ones that are really helping us out. So I just, on behalf of everybody at Lewis, everybody in the country, we're just grateful for what you do, and it's appropriate that we honor you for a week. So, so can you tell me a little bit about why you chose nursing and maybe why you chose Lewis to do your nursing, Kelly? And thanks for being here, by the way.
Thank you for having me. So I went to high school at Tinley Park High School. I graduated high school a semester early. And I actually wanted to be a lawyer my whole life. Yeah. But my junior and my senior year of high school is when COVID hit, and so we started doing school from home. And that's really when I saw like nurses kind of making a really big impact on people's lives. So that's when I really decided that I wanted to do nursing. And my sister also attended Lewis for her undergrad and grad program. She was a chemistry major, so not my field, but so Lewis was always something that we talked about at home. She would always tell stories about her day at school, and so Lewis was always on my list. I definitely applied to other schools as well, but Lewis was my top choice after a lot of.
And I didn't make that connection when I saw your last name, but I knew your sister, and she's awesome. What is she doing now?
She works at a lab,
That's what I figured as much. So, awesome. So, thank you to your family for, you know, being a part of our community and making such a difference. So, we're really grateful that you're here. So, how? Tell me about. Maybe both of you can do this. Tell me a little bit about the nursing program. Maybe I guess I'm looking for not. Maybe you can get to later what makes Lewis Nursing unique, but kind of what is the curriculum for nursing? Like if I wanted to go into nursing, let's say I'm a high school student, you were like, you thought you knew what a lawyer was and you saw nurses out there doing all this great stuff during COVID. What do I have to learn to know, and what is the kind of progression?
And if you don't mind, if I could ask Tina maybe before answering that question, give us a little understanding of the spectrum of nursing at Lewis, the different degrees that we offer, and the number of students we have, generally speaking. And then the question is really about the BSN program.
Yeah, it was,
you know,
but it's a good point.
So we want to kind of like
we
can zero in on that. You know,
Absolutely.
Perfect.
I think that's what makes Lewis special too, is that we have the full spectrum, right? So we have the traditional nursing program, the typical high school student right out of high school for a year, where they get all the baccalaureate characteristics met, in addition to then going into the nursing program. Typically a 4-year degree. We also now have our accelerated BSN degree at Oak Brook. We've had an accelerated program here on the Romeoville campus, and now we've expanded that to include not just students with prior bachelor's degrees, but students who are adult learners who want to go back to school and become a bachelor's prepared nurse. So we have those nurses being trained now at the Oak Brook campus, and we're looking to expand that at the St. Augustine at Lewis campus, which we're really excited about to grow the program. So that's just the BSN program. So then we have our graduate nursing program. So there's 4 tracks in our graduate nursing program. Okay, so the nurse practitioner track is the largest track. That attracts the most students. Within that nurse practitioner track, there's 4 specialties, believe it or not. In that we have our acute care nurse practitioners who generally work in an acute setting like a hospital setting. And they almost function similar to a hospitalist, like an internal medicine type role in the hospital. Then we have our, so the family nurse practitioner program is probably the largest of all. That attracts the most students. That covers, you know, from infants, you can take care of infants and childbirth all through the spectrum of ages. Then we also have our psych mental health nurse practitioner program, which is in great demand now to have mental health nurse practitioners to help kind of fill the gaps, especially, and provide excellent care to patients. And then we also have our family nurse practitioner?
Is it
Oh,
gerontology?
adult gerontology, which is really the spectrum from adult to elderly. So that's just the nurse practitioner track with those 4 specialties. We also have the school nurse program, which is wonderful. We have some Lewis nursing faculty who recently completed their certificates for that. We have our health science leadership track for the graduate program, which you can get just a master's degree and do that program, or you can do a dual degree to get your MBA. School nurse, nurse practitioner, and we have DNP. We have a DNP program, which I did here at Lewis, which is absolutely extraordinary. And so we have such a broad spectrum of nursing education here at Lewis.
So can you, before we get to the undergrad curriculum, now I have a question about this. So you talked about all these nurse practitioner tracks. Can you just help people understand, because I think different states have different rules in terms of nurse practitioners being able to provide care with or without the assistance of a physician.
Yes.
So could you talk a little bit about that? And again, somewhat, why would somebody who's a nurse right now want to become a nurse practitioner? Like they're a bachelor level nurse.
Yes.
Right, Natalie's going to go out, she's going to work somewhere for 5 years.
Yes.
Why would she come back here and become a nurse practitioner or do a DNP?
So that's a great question. First of all, it's filling that role is not really like a physician assistant type role. Nurse practitioners can practice independently in certain states, and even like within the VA system in particular. And to be able to be an independent practitioner is a huge, beautiful. It's a great.
Meaning you can put out kind of quote unquote your shingle.
Yes.
You can have your own office.
Set up your own
practice. You can have patients
practice.
come in,
Absolutely.
take insurance, do all of that kind of stuff.
Absolutely.
Because I think that's a big deal for people, and it changes people's perception of nursing from, well, the nurse is there to assist me when I'm in the hospital, or the nurse takes, helps me when I'm going to do my normal physical. But this is, no, I go to my nurse practitioner, and she takes care of me. Period.
Fully.
Right?
Absolutely.
And I'm in gerontology, she takes care of me there.
Yes.
I'm a hospitalist, she takes care of me, or he takes care of me in that setting.
Absolutely. They can practice 100% independently. Even in states where you can't practice independently, you will be surprised how independent nurse practitioners practice. Even in the hospital setting, for example, which you think is kind of higher level care, that they can practice pretty independently. Usually then with a collaborative practice agreement with the physician from a legal perspective. But what they do and how they do it is pretty impressive in terms of being independent.
Yeah, it's really great. And again, it's such an important part of our healthcare system, obviously. That's why we celebrate. Without nurses, we'd be sunk. So
Absolutely. I forgot to say, in those 4 tracks for nursing, nurse educator is its own separate track. How can I forget that?
As a nurse educator.
As a nurse educator.
That's why you forgot it.
Educators, teach in academic settings, but also in healthcare settings too. In hospitals, there's nurse educators, as you can imagine, to train new nurses who graduate right from a program. So there's so many different things that we have here at Lewis that we're so proud of.
Yeah, thank you so much. And maybe about 1,200 students and altogether in that
Yes,
huge spectrum of different degrees that we
lots
offer.
of growth and expansion is so exciting.
It is.
So
it's a lot of students, 1,200
Yeah,
students.
that's a big part of us at Lewis. So the focus back to the BSN and what happens, whether it's in that adult accelerated format or in the traditional format that Natalie has gone through. So what are the goals? Like what are people trying to get? What are you supposed to get out of this degree?
I'll start and Natalie can join in. So, our traditional program, since we're talking about that, the students get their sciences and their gen eds, again, to meet those baccalaureate characteristics that are required for the degree. Very heavy science base. They take, 2 levels of anatomy and physiology. They take microbiology, pathophysiology, and all of their gen eds, ethics and statistics to prepare them for example, research. and they start their nursing courses in our program their 4th semester. So for 3 semesters, they're doing typical college courses, and then all of a sudden, sophomore 2 semester, they're wearing their uniforms, they're in the simulation labs, and they're going to the hospitals, and it kind of builds from there.
So Natalie, could you talk about that? Maybe those two, I know you're still taking non-nursing classes after you get through with your 3rd semester, but if you could just talk about like maybe the difference, because I think it feels to me as an outsider like there's a big difference between those first 3 semesters and then semesters 4 through 8. So could you talk a little bit about that?
Yeah. So it's definitely a big adjustment and change to go from like taking your gen eds or online classes even to going to simulation and going to clinical and going to 3-hour lectures or whatnot. So it was definitely an adjustment, but you quickly like get used to it with being in classes and going to clinical and being around people who are doing the same thing as you. I think that's also what helps. With gen eds, I feel like sometimes there's different majors around you, and I feel like with nursing, you really get close to the people in your classes and you go through it with them for the next 3-4 semesters. And so that helps kind of adjust to the difference.
And are there people, I don't, maybe this is for both of you, but maybe I'll start with you, Natalie. Do you feel like I feel like with most people, people end up in a place, but one thing was harder than another. So my sense is when I hear all those classes, and I was a science major when I was an undergrad, but for some people it might be kind of like put offish, like pathophysiology, anatomy and physiology. I'm like, whoa, I don't know if I can do that. I'm talking now about, I'm a senior in high school, I'm taking biology, maybe I've taken chemistry, but I'm like, whoa, that sounds really hard. But the nursing clinical sounds really great to me because that's where I'd like to be. And maybe some others who are like really great at memorizing anatomy and then they get into the clinical setting and it's a stretch. So it feels like, I don't know, Natalie, because you're a cohort, you know these people well, you're now near the end. Are there some of your classmates who, boy, that first year and a half was really hard because I had to take all this biology, chemistry, anatomy, and then they got into the clinical setting and it was like they found their home, and then other people maybe vice versa.
Yeah, so there's definitely like a group in each of those categories where like some people were just really great at gen eds, others are great at taking nursing classes and being in the clinical setting and communication skills and kind of beyond the textbooks. So yeah, for me personally, I feel like nursing was really what I was excited for, and like being in the clinical setting and talking to patients, and like I said, I wanted to be a lawyer, so like I love talking to people and I love that aspect of it.
Nice.
But I was like, ooh, like anatomy and micro, like those kind of scared me. But I knew that I kind of just had to get through those. They're very important classes, but I knew that it wasn't going to be like that forever.
Yeah.
And I've also heard that like being a nurse on the job is very different than going through school.
Sure.
So it was just something that you had to do to get to where you wanted to go. So yeah.
So maybe, Tina, could you talk about, so that clinical aspect, how does that work for, like, from a faculty perspective? Because we have to find those clinical placements, right? Help a student get in there, and then what is that? What is the relationship between clinical faculty and the hospital or setting, wherever they're at?
Well, I'll give you a great example. I actually had Natalie in our Adult 1 Med-Surg clinical at Everett Hospital, where I had worked for 22 years. I was honored to be able to go back there, and I had I still have great relationships there, and that benefited everyone. It helped me kind of in my transition to my job. I'm just going to be honest, because I was there for so long. It benefited the students greatly because everyone was like, oh my gosh, we're so, you're so lucky to have Tina. Not to pat myself on the back, but it allowed them, the students absolutely love that part in general. I've had very few students who don't like that part.
Maybe just describe it a little bit. So there you are, where are you? You're in the ER or you're on the floor, and how many students are there in this placement with you?
So I was able to choose the unit where we got to go, and I chose it was like a medical surgical oncology unit. Oh, wow. So the students, the patients were very ill because they had cancer, and then they were having big surgeries, right? And so I knew the surgeons, the nurses, everyone there to make it a good experience for the students. So I took 8 students that first semester, and I had to have 2 off unit because the unit could only take 6 students because it wasn't very
small.
large. We had a limited numbers of nurses. So 2 of the students each week got to go off unit and do great things. What they loved the most was being able to go to the CVOR, so the cardiovascular operating room. The CV surgeon let my students, we were the only students ever to be able to go into the CVOR at Edward and watch open heart surgery. So they stood on the stool above at the head of the patient and looked right into the chest of the open heart surgery patient.
And this is in your
How is that
sophomore
for
year?
you, Natalie?
This was my junior one.
Junior
Okay,
one
so you'd already had a little
Yeah.
clinical
Just one time in the
exposure before
hospital
that.
for 5
Okay.
Still
weeks.
very new though.
Yeah, that
Was that hard the first time you were like looking into somebody's open
for
chest?
sure. They told me like if you need to step down, like you can.
Yeah, 'cause
but it
you
was
don't wanna,
definitely
like, faint or something. I might faint
I
in
know.
that situation.
It was a once in a lifetime experience. So I knew I had to take advantage and I knew Dr. Bobo was gonna give us great experiences.
Yeah.
It was wonderful. And the patients have like a transesophageal echocardiogram, so we could even see the heart up close on the monitors in the room. Anesthesia was standing right next to them with the 20 pumps managing the patient. The heart and lung machine is right there with the perfusionist. And so I had worked with the anesthesia group for the 22 years, so they were teaching the students. And the surgeon, I won't say his names because maybe I'm not supposed to, but he would always trick them. He did the same thing, and I told him he would. Every time he started the heart, he would say, "What rhythm is this?" And they would be like, "I don't know," because they knew they were supposed to say. And he'd say, "What is Tina teaching you guys?" But they don't learn that in that semester yet. But really, such great experiences for them in the clinical setting. They get right in there, and that semester, while they're learning pharmacology, they're giving medications to patients.
Yeah.
So it's really like such an exciting opportunity for the students. They love it.
Is there? I don't want this to be negative, but I also want to like. Are there students who, like, get into that setting and like, I know I don't want to be a nurse. I thought I wanted to be a nurse, but I do not want. Or are there people who say, I know I do not want to be in a hospital setting. Like
Yeah.
I'll work in, some primary care person, but this is not for me. Does that discernment, and how does the faculty? Where's the faculty involved with that? Like, are you meeting with students individually and saying, how was this? And what does that mean for your discernment of where you want to be a
And
nurse?
Tina, maybe describe the rotations a little bit. So
Sure.
how do students get exposure to different settings?
Certainly. So they start out with in that first semester where they're in the sim lab for 10 weeks. So we don't let them.
I was going to ask one
Go
of you, it might be useful to explain what a sim
Okay.
lab is.
Simulation. Our simulation lab. Truly, the students wear their scrubs there. It simulates the hospital setting. So when they go in, we really expect them to act like they're in a hospital setting. And so they get to practice all these skills, their assessments on each other, on these, we have high fidelity, medium fidelity, and low fidelity mannequins. So on the medium fidelity mannequins, we can program heart and lung sounds so they can hear abnormals because they assess each other in that simulation lab and they mostly hear normals, right? We practice skills like placing certain tubes and things like that, sterile technique and all that, communication, before they ever go and touch a human, right? So that's that first
And we try to build our labs as realistically as possible.
Yes,
So that
absolutely.
they get
And
a
we
little
have-
comfort level before going, yeah.
That's right, to build their comfort level. For that first semester, they go to the hospital 5 times. After the sim labs for 10 weeks, then they go to the hospital for the first time and do the simple things. They're not doing open heart surgery, right? We tell them
Taking
that so they
temperature.
won't be nervous, right? Like take the vital signs, assess the patient, help them eat, help them walk, those basic things.
Right.
But you learn that, yeah, I was just going to say that, you learn that relational
Yes.
part of it to talk with people, and yeah.
Yes, and then it builds from there. Like that next clinical is the one where they go and see open heart surgery and give medications. It progresses pretty quickly. And then subsequently they do OB and pediatrics. So they go in for OB. They go to NICU. They see regular deliveries. They see cesarean sections. They go to postpartum. For peds, they actually go in to take care of patients in peds. We go to Lurie and Comer. They get great experience. And then their final semester, they do critical care, which they all love, taking care of very critically ill patients and seeing all the high tech And then that very final clinical, they're pretty independent, one-on-one with the nurse. Very similar to what it would be if they were starting as a new nurse and precepting with a nurse on their first job.
Wow.
That's amazing.
Intense.
And then maybe how does it, and I know every student's life is different along these lines, but how does it translate that? How does that translate into getting a job? And is there a common pathway, I guess?
So interestingly, that last course where there are 100 clinical hours in 8 weeks is like having a job with no pay, part-time job with no pay. We usually try to get them in a setting where they have interest,
Yeah, so
right?
they might want to continue there.
And
if
where they want to
possible,
continue.
So that last semester might be, if they want to be in a primary care setting, they might go work there. If they want to be in a hospital, if they want to be in an ER, you try to get them into that situation. And is it also not just that I want to be in the ER, but I also want to be in the ER at Edwards versus
Yes.
being at the ER at Silver
Yes.
Cross, being at Christ, so that I might get to know people, and then when I apply for a job, they already know me.
Yes, in fact, we try our best to do that. And because the hospitals invest so much in those students during that rotation, because the nurse is really spending one-on-one time with that student, that we kind of are looking for a commitment from the student that they may want to work in that hospital.
So if they kind of, the assumed relationship between these, obviously it's a symbiotic relationship between
Yeah.
healthcare providers and universities that
Yes.
educate healthcare workers. So that idea that you're saying is that if that hospital offers that person a job, they don't want 8 out of 10 of them saying, no, I don't want that.
That's right.
They want a good fit. You know, obviously there's going to be some people who after they work there like this commute's too long or the whatever, you know, but in general, they want that to be a yes when they
Yes.
make that offer.
Yes, it benefits them greatly too, because they need nurses.
Oh, there's a huge
We need
nursing
them to
shortage.
train, and they need
Yeah.
our students, and they want our students.
Yeah. And
So
I go ahead.
Oh,
please.
we're running up
running
on
out of
time a
time,
little
yeah.
bit, and I really want to ask
Yeah.
get one more topic out there before we stop. So I've certainly, I've lived in this area for 7 years now, and I have been to the hospital a few times, and I've experienced firsthand. As soon as I tell them where I work, they often are like, "Oh, Lewis, they have the greatest nursing program in the area," it's really palpably clear what a great reputation Lewis has in the medical community, in the region. And so I just want to ask, what we've heard today is it's this combination of really not demanding, but really excellent academic preparation in the health sciences, in those courses that you talked about, in the sciences and the health sciences, in the nursing program, in the simulations, and in having those clinical experiences. But it probably is a little bit more than that in terms of what makes Lewis special or what makes a Lewis nurse special. So I just wanted to ask, especially you, Natalie, what's your feeling, kind of getting close to coming out of it?
Yeah. So actually one of my deciding factors for coming to Lewis was also because I heard so many good things about Lewis's nursing program, and I knew that nursing students that graduated from Lewis had a really good reputation in the hospital setting. And I actually experienced that through my clinical time, and nurses will literally tell me I can pick out Lewis nursing students from students who go to other universities. And I don't know exactly what they do at other universities, but I'm a very strong believer that I will graduate this program and be a really competent nurse and know what I'm doing, and be confident in my skills and my knowledge. And so, I think that speaks volume to Lewis's nursing program.
Yeah, that's awesome. And I two things that I want to say as we begin to wrap up. I serve on the Silver Cross board. We have a nursing shortage. We feel it on the Silver Cross board level because it impacts our budget, obviously, and the ability to serve patients, because if you don't have enough nurses, you can't serve the patients. So that's a challenge in the country. So I want to then maybe get both of you to respond to this. So if you were trying to, in a 30-second commercial, convince more people to go into nursing, what would you say to the people that are watching us? So we know we have a nursing shortage in the country. That's just a fact. And it looks like it's going to continue and maybe get worse because of just people who crunch numbers and say there's going to be more need for healthcare and the nursing may not. So there's a high school student watching this or a parent of a high school student watching this, how do we convince them to choose the nursing profession?
I could start.
Okay, go.
I think it really all goes back to like your purpose and what you want to do in life. We kind of talked about like having a calling, and I know that kind of ties in with like our LaSallian values. And so, yeah, I feel like having a why and what you want to do is really important in this profession. And I feel like if you have a strong why, and that why can change every day, every week, every month, I think that's a really strong pull to nursing.
Yeah, because it's meaningful work.
Very meaningful, yeah.
Yeah. Tina?
I would echo that. I feel like looking back on my career, because I've been a nurse 38 years, and looking back on my career, it has been incredibly fulfilling for me. You realize the impact that you have on people's lives when they are in some of the most vulnerable, you say this always, vulnerable times in their lives, and how important it is that you make that connection, right? So it's a science-based profession and an art, right? The caring, the compassion that you have, you speak about the calling. So it's incredibly rewarding. There's so many different opportunities within the profession. You can do so many different things. And yes, it's just incredibly rewarding, an honor to actually care for someone when they really need you to provide care.
Yeah.
And I'm going to add another thing. This was great. Those are awesome responses. And I just want to be pragmatic. Though nurses probably would love to get paid more, nurses are compensated well as a general rule. And especially if you become a nurse practitioner. Like there's opportunities to move up in the nursing profession and get compensated. So it's not just giving back to the world. It is giving back to the world. And it's incredibly meaningful. And you can live a good life and pay your mortgage and do all of those kinds of things, right? It's not just, and I think both those things are really good, right?
Absolutely, we do
I'm
say
going to
that.
school and I'm going
And
to, people
you get a
care.
job
Yeah,
right away,
people, you'll get a job
Yes.
and you're going to get fairly compensated because we really need you, and that's a good thing. And it's going to be meaningful work. So then, and that for me is the sweet spot, right? If you can do meaningful work, feel really like you walk away at the end of the day and you know you made a difference in people's lives, and your paycheck is something where you can actually pay the mortgage and help your kids and do all those kinds of things. That's a win.
Yeah. That's important. The students who come, they love hearing that. We definitely
That's
say
why I
that.
wanted to say it out loud. Is like
good.
That's an important thing to say. I think.
Yes.
So.
All right.
Thank you,
Natalie. Thank you so much. I'm
thank you
so glad you're
much.
going to be a nurse, and
Thank
the
you.
world
Yeah.
will appreciate you. And Tina, thanks as always.
Thank you for having us.
And thank you all for joining us today. As Chris said earlier, we have just a few more shows this season. Today was great. Stay tuned because the next few are also going to be great. We have a lot to celebrate. Many blessings to you and all those you love. Have a great weekend.